Good afternoon, everybody. Christine Barconi here in the NBC4i Streaming Center. I am joined by Representative Allison Russo right now, and I want to talk about your initial reactions to the governor's announcement last night that the statewide health orders will be lifted in 3 weeks on June 2nd. So what was your initial takeaway from that?
Well, I think my initial takeaway is not a terrible amount of surprise. I think given the pressures that we have seen from his Republican colleagues in the State House, as well as, I think probably what he is anticipating in trying to stave off some of that conflict. I think the unfortunate thing about it is, he did set a goal originally of where he wanted our new case rate to be. And we don't know if we will reach that by the date that he has set. I'm hopeful. Certainly our projections are looking pretty good if people continue to get the vaccinations, if we are still taking the proper amount of precautions that we need to, especially in public places. So, time will tell. I'm hopeful that we will be there. I think that unfortunately, letting the politics outweigh the science and the data is not helpful.
A lot of people had a pretty strong reaction, positive and negative, to these incentives as well. So 5 juveniles and 5 adults, the tuition for the kids, and then the $1 million a piece for the adults. What are your thoughts on this? Do you think it's a good idea as an incentive to get people vaccinated, or do you think that money could be spent perhaps in better ways?
Well, I find it very concerning, frankly. I'm not sure that it is the best use of federal relief dollars. That's a lot of money. And frankly, it is a lot of money to be throwing at an approach that is completely untested. There's nothing right now suggesting that that's really going to move the needle on increasing the number of vaccinations, increasing the vaccination rate that we have in the state. Instead, I would like to see that money be used for things like, let's get vaccines out to places of employment, incentivizing employers, especially for our hourly workers, to give them the time off they need to both go get a vaccine, as well as if they're having side effects, to take a day off. Getting vaccines into our primary care physician offices, where we know that doctors can be incredibly influential with people who have hesitations about vaccines, and getting them comfortable and answering their questions. So I think that there are a multitude of more effective ways to use that money. And I think at the end of the day, the biggest question is it a legal use of those federal relief dollars?
Okay. I know that's something that the state attorney, or Attorney General Dave Yost, is looking into right now. Got a statement from him, and I know we're going to be following up with him on that. So something we are also looking into, as well as several of your colleagues right now. So vaccine eligibility opened up this morning for Columbus Public Health for those 12 to 15 today. What are your thoughts on that? And what is going to be your approach to help get people in your district vaccinated, especially these young people, where we're seeing a much lower percentage of vaccination rates here in Columbus?
Well, first of all, as a parent of a 14-year-old and an almost 12-year-old, I'm thrilled that the eligibility has opened up. And in fact, I will be taking my own 14-year-old very soon to get his vaccination under the advice of my own pediatrician. So I feel very comfortable with that. I think that it is important that we get these younger kids vaccinated as quickly as possible. I'd like to see some of the same efforts that we've done with both college students and our high school students. We've had the University Medical Center, and we've had the local health departments partnering with the high schools, for example, actually bringing them to school to get kids vaccinated. We're at the end of the school year, but I hope that we are very aggressive in partnering with our schools, our public health departments partnering with our schools to at least get kids their first shot before the end of the school year. But personally, for me as a state representative, and talking with my constituents and neighbors, it's sharing my own comfort level with vaccinating my own children. I know these are personal decisions that parents have to make, and I would encourage anyone who has hesitation, reach out to your pediatrician, reach out to your healthcare provider, and ask those questions, because I think they are fair questions to ask, and everyone should be getting the answers that they need to those questions if they have hesitation.
Why do you think it's important people ask and heed the advice of their pediatricians versus something they might see elsewhere?
Yeah, I think what we have learned in this last year and a half throughout this pandemic, there is a lot of misinformation available on the internet. So I encourage people, and I think it's very normal to have questions about all of this, but talk to your healthcare provider. They have the medical training, they have the expertise and they know you as a patient or your child as a patient to be able to best answer those questions. So I say, just because it's on the internet doesn't mean that it's true. Seek out people who have been trained in this and who know you as a patient or your family as patients, and ask those questions to them.
Whenever you talk to your constituents and your neighbors who do have kids, what are their thoughts, just generally across the board, anecdotally? How are they feeling? What's the pulse like in your district?
Well, I can say that in my particular district, parents are thrilled that their younger kids are now eligible to get the vaccines. Many parents were happy when it opened up to 16 and older. And in fact, again, we have the local health department partnering with some of the local schools in my district. And we had great uptake in vaccinations. I was seeing the same for even our families who have college students as well. Many of our universities were giving vaccinations on campus. So I think overwhelming, the response that I have seen has been very positive. But again, if people have questions, and I think it's very normal to have questions, reach out to your pediatrician, to your healthcare provider, and get the answers to those questions from a reliable source of information.
Okay, last question for you. So I talked to Dr. Roberts this morning, and she is not quite sure about these health orders being lifted quite yet, especially here in Franklin County, where our vaccination rate is roughly 43%. She said that she would really like to see it be greater than 50, and her most comfort level would be 70% really to get there. What do you think is the best way we all as citizens can encourage that and help get that rate up to I guess encourage people around us to get vaccinated? Because I feel like it's an uphill battle at this point. Everybody who really wanted it, they got it.
Yeah. So I think the best thing that you can do as an individual citizen is, you may never know who you are a trusted messenger to. So you share your vaccine experience. Be honest if you had side effects, but share that. I mean, I have said that, I do believe my role as an elected leader is to share when I've gone and received my vaccine. I've been vaccinated, fully vaccinated, talked about any side effects that I had. I encourage individuals to do that. Reach out to 5 people that and ask them, do you need help finding a place to get vaccinated? Have you been vaccinated? Do you have any concerns or questions about it? Because you may be a trusted messenger for that individual.
All right, Representative Russo, anything else that you would like to add that I have not asked you this afternoon?
No, thank you for interviewing. And, I would just say to everyone, get your shot. It's so incredibly important for us to be able to get back to normal life and to move past this pandemic.